At a time when health equity and social justice are more critical than ever, Duke University School of Nursing stands at the forefront of this movement. My name is Michael Carey. I'm a nurse and associate professor here at Duke. I'm also the Equity Scholar for Duke AI Health. I'm proud to lead efforts that harness the power of AI and advanced technology to create a healthcare system that provides ethical and equitable care for all. At Duke, my work focuses on eliminating bias in healthcare algorithms. AI must not perpetuate disparities. It should be used as a tool that drives fairness. Through research, education, and collaboration with healthcare leaders, we're advancing models that follow the Health Equity by Design framework, making sure that no patient is left behind. In education, we're designing training programs to ensure AI tools are deployed responsibly, enhancing both care quality and patient safety. Our interprofessional team that includes representatives from across the university, from nursing to medicine, therapy, bioethics, biostatistics, and engineering, work closely with healthcare system and academic leaders to build training programs that reflect real-world needs. This commitment culminated at our Path Fair Health workshop, where we train health professionals to identify and mitigate bias within clinical algorithms. This hands-on experience empowered participants to apply mitigation strategies to real-world case studies, shaping a healthcare system where every patient receives equitable and ethical care. Our recent publication in Health Affairs provides actionable strategies for eliminating bias in clinical algorithms. It responds to the Department of Health and Human Services' finalized rule against discrimination in clinical algorithms. This review offers a roadmap for researchers, developers, and policymakers to embed equity in every stage of the algorithmic lifecycle, from design and development to deployment in health systems. Equity in healthcare is not just about compliance. It's about building a future where bias has no place and every patient, no matter who they are or where they are, receives the care that they deserve. Thank you, and I look forward to continuing this journey towards a more just and equitable healthcare system.
Hi, my name is Will Ratliff. I'm an Innovation Program Manager and Data Scientist with the Duke Institute for Health Innovation. We're a team that sits between the School of Medicine and the health system and are made up of data scientists, data engineers, qualitative research scientists, innovation program managers, among others. Our mission is to catalyze transformative innovation in health and healthcare at Duke. We've put more than 40 AI ML models into practice here since we were founded about a decade ago. For each of those solutions, we focus on working collaboratively with our clinical and operational leads to first identify the problem and opportunities to make an impact on clinical and process metrics that we identify with them. We co-develop and design and train and test our models retrospectively using data and then prospectively validate them in silent mode with our clinical champions to assess validity for a minimum viable product implementation. We then work to set up monitoring and governance as needed as we get ready to bring that solution live. We take it live with our clinical champions with an identified workflow we collaborate with them to develop that aims to be low burden and high impact. Once we go live, we rapidly iterate on the technology and the process as needed under the guidance of our frontline care users. And then we measure and report on impact against those previously identified metrics of interest to our key stakeholders and to our frontline care users. I'd be glad to talk about any of this with you all, and thank you for listening.
Hi, I'm Michael Zablanos, and I'm a professor in the Duke Pratt School of Engineering, an Amazon Scholar with Amazon Robotics, and I also lead the Healthcare Systems Optimization program with Duke AI Health. In our research group, we study problems in control systems, optimization, and AI with a focus on robotics and autonomous systems and healthcare. In the healthcare space, we're particularly interested in optimization and AI methods that can provide us with a systems level understanding of complex healthcare workflows that is needed to improve decision making and, as a result, operational efficiency and delivery of patient care. While artificial intelligence models are already revolutionizing healthcare, they often fail to demonstrate impact when used by healthcare providers in a complex health system. The reason is that their development most often focuses on their predictive ability and does not factor in the effect that their use can have in complex healthcare systems that involve intricate and interconnected sets of decisions. An example are surgery duration and length of stay predictive models that have been widely studied recently as they promise to significantly improve hospital operations. The premise is that providing the most accurate surgery duration and length of stay information to human schedulers will allow them to make optimal operating room scheduling decisions that will increase surgery throughput, streamline OR utilization, and reduce surgery cancellations. But reality is that it is just not possible for human schedulers to evaluate all possible scheduling decisions in order to select the one that optimizes OR efficiency, more so given the multiple performance metrics and operational constraints that these decisions need to meet. In an effort to better understand and begin addressing this challenge, in collaboration with the Laboratory for Transformative Administration in the Duke Department of Surgery, we recently developed an OR scheduling optimization model that leverages past electronic health record data to improve the efficiency of OR utilization and the predictability of postoperative patient flow. We validated our optimization model on EHR data from Duke cardiothoracic, neurosurgery, and ambulatory departments and showed that it achieves significantly better performance compared to that of human schedulers in terms of throughput, OR utilization, waiting times, and daily patient discharges. Our goal moving forward is to go beyond OR scheduling and develop new systems-level methods to model, analyze, and control complex healthcare workflows by combining data and predictive modeling with decision sciences, such as mathematical optimization and AI. For example, we would like to answer research questions such as, is the current utilization of our available resources optimal given a desired set of performance metrics? And if not, how can we do better? What resources do we need to achieve a desired performance? And what are the trade-offs between different performance metrics, and which ones should we prioritize and when? To answer these questions, we need to bring together researchers, clinicians, and students from engineering, medicine, and the health system to develop new research and technology that is not only academically sound, but can also have an impact on operational efficiency and patient care, driving innovation in next-generation healthcare systems.
Hi, I'm Amanda Randalls, the Alfred Winborn Mordecai and Victoria Stover Mordecai Professor of Biomedical Sciences at Duke University. I work in the Biomedical Engineering Department, and my research focuses on developing large-scale, patient-specific models of blood flow. The problem we're addressing is to better predict, and prevent adverse cardiovascular events before they happen. Cardiovascular disease remains one of the leading causes of death worldwide, and existing diagnostic tools often catch problems too late, or they can require invasive procedures. Our goal is to create digital tools that can give the clinicians the ability to intervene earlier and with high accuracy. So the way we're doing this is to create digital twins, specifically a vascular digital twin, like what you're seeing here. It's essentially a 3D model of a patient's blood flow. So to help you build intuition, this is a video that's going to show you an example simulation run. We're modeling that patient's blood flow in areas like the coronary arteries. These digital twins can already assess whether a lesion needs treatment by looking at a single heartbeat and the blood flow changes that you see across that heartbeat. But we really want to go further. By expanding our models to capture weeks or even months of blood flow data, so far we've gotten up to 4.5 million heartbeats. We can better understand long-term trends and identify risks earlier. What makes our work unique is our longitudinal hemodynamic mapping framework, which uses wearable devices and AI to create these long-term models. So we're able to drive these simulations from data we're collecting from commercial-grade wearables and see how a patient's blood flow is changing over time as they go about their normal daily activities. We can also sync this to Harvai, our virtual interactive treatment planner, that allows us to take these digital twins and let the doctor try out different treatment options before they ever enter the operating room. We can then simulate these different treatment options virtually and allow for more personalized and proactive healthcare. This approach not only addresses the immediate needs of individual patients, but it aligns with this larger vision of transforming healthcare through predictive modeling and real-time intervention.